everyone, I'm Stephanie with 9 Health, and today we are talking about shingles and Immunization Awareness Month. We've been talking about it all month. So last week we talked about the flu vaccine. We're going to talk about shingles today. This is Health Happens, our show we do every Tuesday to bring you objective, real health information and connect you with experts here in Colorado. So today we're talking with Dr. Peter Rice from the University of Colorado Skaggs School of Pharmacy. Thanks for joining us.
Thank you, Stephanie.
So shingles, it's a very effective vaccine, which is good. Tell me first, what is shingles? How would someone know if they had shingles?
Shingles is a rash that's related to the chickenpox virus that almost everyone has had at some point in their lives. From the point of view of diagnosing shingles, it always starts in a particular, what's called the dorsal root of the spinal cord, and so it affects a very discrete area of the body on one side only.
Oh, okay.
And patients will develop little blisters, that, just as they do with chickenpox, that are usually fluid-filled. They can be painful, and it's very diagnostic that it's just one side of the body that's innervated by a particular root from the spinal cord.
And is it typically older patients? My husband, he never went to the doctor, but we think he had it a little while ago, and he was maybe 30. But is it typically older patients that get it? Older people?
It is typically older patients who get it. The incidence rises as patients get older and older. But one of my kids had it when he was like 19 years old.
Okay, so really anyone could get it.
Anyone could get it, and it differs in severity.
Okay.
What's usually not recognized is the impact that this has on patients. I can remember a patient years ago hanging around the pharmacy asking, could she get the vaccine yet, because it was only recommended for patients 50 or older, and
right.
she was waiting to turn 50. And when you have had shingles and you've had what's called post-herpetic neuralgia, the pain that can last 6 weeks after the shingles goes away, patients can be very highly motivated.
So if you've had the chickenpox as a child, you shouldn't get shingles?
No, you can still get shingles. I think we're waiting for that generation to age enough that we have the statistics on that.
Okay.
Originally, it was felt that if the chickenpox vaccine might prevent shingles, but it's not really playing out that way. Folks still can get shingles.
Okay. So again, we're talking about the shingles vaccine. It's Immunization Awareness Month. We're with Dr. Peter Rice. He's a clinical pharmacy professor at the University of Colorado Skaggs School of Pharmacy. If you have any questions, just post them, ask them if you have any questions about. Yes, we have questions already. Okay, what questions do we have?
Okay, this is really cool.
Why should you get the vaccination? And then we have another question about how available is the vaccine.
Yeah, there is a shortage of Shing Grix, which is it's a newer vaccine. But first, why should you get the vaccination?
You should get the vaccination to help prevent shingles if you are worried about that. That is more of a concern for folks as they get older and older. The incidence of shingles is about 500,000 to 1 million patients a year will get shingles, and about 1 in 3 patients will get it during their lifetime.
Okay. And I had just mentioned that Shing Grix, which is the newer vaccine. Talk about the development of that vaccine and how effective it is, and the shortage.
Well, that is a vaccine that was developed as a recombinant shingles vaccine, varicella vaccine, that was developed, and it is more effective than the previous vaccine, which was Zostavax.
Okay.
The new Shing Grix vaccine is 2 doses that are given intramuscularly at least 6 months apart. The good news is that they're highly effective. They prevent somewhere between 90 and 100% or actually 90 and 97% of cases of shingles.
Yeah, because the old vaccine was like 60%.
The old vaccine averaged around 51, but as patients got older, it became less and less effective. So for patients who were older than about 70 years of age, it was only about 18% effective. So at that point, you're questioning, okay, should I get it or not? So the good news is this one is more effective. It prevents about 90% of the post-herpetic neuralgia, and that doesn't seem to be related to age.
And that's the pain?
That's the pain that people are trying to avoid. Getting some bumps on you in a discrete area of your body wouldn't be so bad. It's the pain that's driving patients to get the vaccine. The bad news with the Shing Grix vaccine is that it is more painful than the previous Zostavax vaccine.
Oh, just receiving it can be painful?
Receiving it can be painful. Vaccines are not just the material that we want to be antigenic. They also include substances called adjuvants that stimulate the inflammation response and encourage folks to develop antibodies and immunity based on the vaccine.
And there was a shortage because maybe it was more popular than they thought it was going to be. I feel like maybe that was the case. But is there still a shortage, and how do people get it?
People can get it through their primary care providers or through their pharmacies. Because it is so expensive to carry, some pharmacies would prefer that patients let them know a few days ahead of time so they can order it in and have it for you. And that's probably the best way to do it, and to also overcome some local shortages that come on. It's not surprising to me that there's a shortage, because we're coming back on a vaccine that was only moderately effective, about 50% effective, and less effective as patients got older. And as I said, this can be a very painful condition. And if you're a patient who's had this, you're going to be highly motivated to get the new vaccine because of its effectiveness.
So if you've had shingles, the vaccine would still help you?
I don't think they recommend getting the vaccine while you have shingles, but
after the fact,
after you get it, it is useful to get the vaccine to try and avoid future incidences.
Okay, and we talked about how effective it is. That was kind of my other question, but who can get it? Do you have to be older to get it? Because we were talking about that off camera before, that the age was about 50 years old to get it, but that anyone can get shingles?
The old vaccine was only really tested in patients 60 and older, so it was recommended for that patient group. This was tested in patients 50 and older.
Okay.
And has been shown to be effective, so the patients can get the vaccine anytime they're over 50. Just as with the old vaccine, if you are a patient who consistently gets shingles every year, and particularly the painful form afterwards, talk to your primary care provider and see if it's okay for you to get the vaccine early. It's not been tested in that patient group, but if you're a patient who gets shingles regularly, the benefit is really high for you.
Man, I didn't realize you could get it more than once. I thought I thought it was kind of like chickenpox. You get it and then it's done. I didn't know you could keep getting it.
Oh yeah, no, there are patients who this has been their life, and that's why the vaccine is so important to them.
Right, and popular, and there's a shortage.
Yes.
Are there any other questions?
We do have a question. Can the vaccine give you shingles?
So that's kind of one of my other questions too. Is sometimes that's a debate with vaccines. Is people feel like they're going to get whatever it is if they get the vaccine. Yes,
no, and the answer for this vaccine is no. This is a recombinant vaccine, so it contains a discrete part of the herpes zoster virus that will be recognized by the body. It doesn't contain the live virus as some vaccines do. So no, this will not cause you to get chickenpox.
The old version of this vaccine was that, or the other version of this vaccine, isn't that a live virus?
There are several varicella vaccines ranging from kids to shingles and on up, and some of them were responsible for exposing folks to the virus and
but Shing Grix,
causing.
No.
Shing Grix, no.
Not a live vaccine. So, any other questions? Not right now. So it's also Immunization Awareness Month, and vaccines are debated a lot. So, and you're a professor of clinical pharmacy, but still, kind of give me your thoughts on, as good as you can, your thoughts on vaccines and whether or not they are safe. Just kind of give your pitch for getting vaccinated.
Yes. I emphasize that nothing is universally safe. It's always a combination of looking at the benefit that the patient will get versus the risk. And
that's good.
That's part of why we're looking at folks, and they're 30 years old, and 30-year-olds don't get shingles, and so we don't give the vaccine in 30-year-olds. As patients get older, the benefit of the vaccine goes up and up, and the risk pretty much stays about the same. And particularly if a patient has had shingles already, then you know that you may be prone to that, because 1 in 3 Americans will get that at some point in their lifetime, and you can get it multiple times. That would be definitely be a good time, if you haven't already received the Shing Grix vaccine, to go ahead and have it.
Okay. All right. Are there any other questions? Yes? Okay.
Are there any adverse reactions to the vaccine?
You talked about it being a kind of a painful vaccine, right?
What strikes most patients is that it is a painful vaccine. It's considered more painful than the Zostavax vaccine, its competitor.
Just like soreness at the injection site, or
yes, and that's because the vaccine is working. It's got substances in there to encourage an inflammatory response.
Okay.
Inflammation is pain, so there's going to be a certain amount of pain to generating that immunity.
Right.
But it's much less than post-herpetic neuralgia would be if you got shingles and developed that.
Right, which again is the pain from shingles. Dr. Rice keeps using the very big words for it, but
there are and please forgive me.
No, that's fine. I just want to make sure someone's just tuned in. That is the pain you get from shingles, which is none of it's fun, but that's really the not fun.
Yes. So the other question was. Other side effects.
Yes, other side effects.
The other side effects do not occur in a really high portion of the population. there's a very, very slight increase in symptoms of congestive heart failure. So if you're one of those patients, again, you talk to your doc, your primary care provider, and you make that decision so that the benefit of the vaccine is much greater than the risks that you would be taking.
All right, and just to recap, there is a shortage on Shing Grix, but if you call your pharmacy ahead of time, let them know that you want the vaccine, it's more likely that they'll be able to get that in for you instead of just showing up and wanting it. But
yes,
call your pharmacy ahead of time before you get that vaccine, or your primary care. But is there anything else that you wanted to add about the Shing Grix vaccine that we didn't ask?
Not really, but there were some patients worrying about, can I take the vaccine? Whenever you get a vaccine from a pharmacist, they will be interviewing you and asking you questions about what other types of vaccines you have had, if you've had responses, adverse responses to them, and they'll be making a decision as to whether the vaccine is safe for you to take at that time or not.
Right.
So if you have concerns, it doesn't mean don't go near the vaccine. It means talk to your pharmacist. They'll always help you choose what the best medicines are for you.
Yeah, and you can just walk into a local pharmacy, talk to any pharmacist, and they'll be able to help you out.
Yes.
All right. If there aren't any other questions, you can post those, and we'll get those answered by Dr. Rice after this live is finished. But we will sign off, and thank you so much for joining us.
Okay, thank you.